Hello class, this is just a quick review of your ICD-10 coding from chapter 1 for infectious and parasitic diseases. Also a quick review of your table of contents for your ICD-10 coding manual. If you go to the first few pages of your manual, you should be able to see the table of contents. The reason you want to make sure you understand and follow that religiously is because it will guide you to where you need to go, and if you forget anything and cannot find it, this is the best place to find anything that you would like to know. Now remember, your ICD-10 coding manual is divided according to this table of contents. The most important thing that you will be using is your guidelines. Do you see how it says guidelines? And the guidelines helps you understand the coding conventions, coding guidelines, which is the most important thing you need to follow to be a confident coder. Then you have to find the codes in your alphabetic index, which is divided again into a neoplasm table for coding any kind of a growth, cancer, or neoplasms, and table of drugs and chemicals for coding any kind of drug poisoning, chemical poisoning, and situations such as those. External causes index is for any kind of injuries, accidents that are coded using this table. Once you find these codes in your indices, which is all these different categories here, you go to your tabular list. Your tabular list is divided into 21 or maybe 22 chapters, depending upon the book you have. And every one of these chapters, as you can notice, if you can, let me make it bigger, you see that these chapters are divided according to A, B, C, D. Your ICD-10 codes are alphanumeric. The first digit is always an alphabet, followed by 3 to maximum of 6 digits after, so total of 7 digits altogether. And the 3 digits in the beginning is always followed by a decimal. So you can see chapter 1 is all A's and B's, A00 to B99. Chapter 2 is neoplasms, C00D49. So that will help you tab your book. Remember, you have to tab your book so you follow and find the codes as quickly as possible without wasting your time. So what is infectious diseases? Infectious diseases is any kind of infection in the body caused or spread by a personal contact, such as shaking a hand or some kind of body fluids. And remember how we're going through a COVID situation right now. So that is exactly what we call as an infectious disease, such as meningitis, hepatitis, tuberculosis, human deficiency virus, and of course COVID. These are all caused by bacteria, viruses, and fungi. Example of such a code is B95, which covers streptococcus, staphylococcus, enterococcus as the cause of the disease classified. As you can see, the chapters, chapter 1 is A codes and B codes. 3 digits followed by a decimal, and then it can follow by 4 more digits after that. But not all diseases have 7 digits. Some of them have only 3, maybe 4, maybe 5, maybe 6 or 7 digits. You also have to follow your guidelines to make sure that you are coding the exact numbers of the code, not anything more or not anything less. That is your job as a coder. And we also have some Z21 codes, which is mostly covered for something that is asymptomatic. Yes, the person has HIV, but the person is asymptomatic. We can elaborate that later. Okay, so let's code a scenario. As you can see, I have a case here. Francie Holland, 23-year-old female, came to see Dr. Kensington due to a severe abdominal pain. She had a fever and stated that she has had bloody diarrhea for the past 2 days. So as I'm reading, I am underlining, highlighting, putting a bubble on my key factors, keywords that I need to emphasize when I code using my ICD-10 coding manual. So I highlighted highlighted severe abdominal pain, bloody diarrhea, and the patient or the doctor also revealed that she was dehydrated as well. Francie stated that she ate at a new restaurant at the beach where she had a salad and a veggie plate. After taking some tests, he diagnosed Francie with Shigella dysenteria, bacillary dysentery. So since I know the diagnosis, right? I know the diagnosis. The doctor already gave me a diagnosis. I don't need to worry about the sign and symptoms, because these all sign and symptoms are are related to the disease that the doctor diagnosed. If, according to the guidelines of ICD-10, if you have a diagnosis, you do not code for sign and symptoms. Okay, so we are not going to mention that. Unless you know that one of these symptoms is because of something else, you are only coding for the diagnosis that the doctor seems confident upon. Okay, great. I have a diagnosis, Shigella dysentery. Now we turn to the alphabetic index, okay? And we try to find the main terms. What is the main term? The main term is one word that will help you find the code in the index. If that word, one of these words, is not the right word, we cannot call it a main term. We are just assuming it to be a main term for now until we are sure that yes, that is the right word that will help us find the code in the alphabetic index. So what word are we going to be using? We have two choices, right? We have the word Shigella and we have the word dysentery or dysenteriae, however you want to say it, right? So we can go both routes, and let's take a look at the alphabetic index. So here we are in your alphabetic index looking at the alphabetical organization of the words, and I see dysentery, right? And under the infection, which is just the name of the infection altogether, we also see Shigella, right? Now you have two choices. You can go either way. So let's see what happens if we go under dysentery. So the dysentery has a lot of modifiers. These are called essential modifiers. That means the doctor can write any of these words and they will all fit this diagnosis. Dysentery, for catarrhal, diarrheal dysentery, epidemic dysentery, hemorrhagic dysentery, infectious, sporadic, tropical. But I only have to go and follow this line and see what it fits to. Okay, now remember the bacillary can be confusing for you, but bacilla is just another name for the Shigella family. And if you go under that, you will see Shigella is followed by dysentery, which is what we are looking for. But if you're just looking for Shigella, again, you can also do that, but it comes under the word infection and then Shigella. And Shigella is again followed by the word dysentery. Do you see how this line connects the dysentery to Shigella, which is the right pathway for us to follow? And these are the alignments given to us to follow the indented wordings below so that we can connect the words together and follow the right word for the right diagnosis. So our code matches A03.0 for shigellosis, Shigella dysentery, or dysentery Shigella. Okay, remember, this is the confusion we will always have, and we just have to put them together as per the index and as per how we find the main term. So in this way, our main term can be Shigella. Our main term can also be infected or infection, and our main term can also be dysentery. Any other word that comes after the dysentery, all of these words which are under dysentery are called subterms. Any word under the Shigella that you found using the main term Shigella can be your subterm as well. Okay, Shigella and everything under that is a subterm. How do we confirm if this code is correct, A03.0? We always go to the tabular list. Remember, the tabular list is the second half of your book, giving us the coding specificity. Before we confirm a code in the index, we have to verify the code in the tabular list before we put it on the claim form to be sent to the insurance company. So let's go to our tabular list. If you have tabbed your book, you know where to find this code. If you have not tabbed your book, you go to the second half of your book, start looking at the top pages, and the top pages are organized according to the alphabetical order of the ICD-10 codes. You look for A03 and you will see that those pages will help you get to the right page, and you will see that it is chapter 1 for infectious diseases, and you are looking for A03.0. And why do you do that? Because remember how this information is giving you the exact description, exact keywords that matches every word the doctor wrote down for you on his documentation, on his SOAP note. That is the key factor to remember. Remember, if you make a mistake here and you put this code on the claim form and it gets denied by the insurance company, the doctor does not get paid. That is the key factor you have to remember as a coder. So now that I'm sure shigellosis due to Shigella dysentery, I can easily, confidently use this code to be put on the claim form and confidently file it to get a proper reimbursement. One last thing we need to do before we finalize everything is to see if there are any coding guidelines that I need to follow. Now remember, this is your tabular page, okay? Anytime you need to confirm a guideline for the particular code you're looking for, you want to read the category code. What is a category code? Every code family, as you can see, has a 4-digit, 5-digit. It can go to up to 7 digits. But the category code is the parent code that is giving you any guidelines that needs to be taken care of before you finalize a code. And you always look at under the category. And the category code for this is A03, which I don't see anything written here. This is, remember, this is the tabular section of your ICD-10 coding manual. Just to be sure, I also want to check the coding guidelines section of your ICD-10 coding manual, which according to your table of contents is the section 1, okay? And which coding guideline am I supposed to be checking for this in case if I have to? The official guidelines tell us to go read ICI. What does that mean? This is a mapping of the guidelines for coding for Shigella, right? How do I get there? So let me show it to you. Once you open your coding guidelines section 1, do you see how it says section 1 conventions, right? So section 1 is conventions. So I need to go to section 1, which is where I was. I don't know how I got lost. Let me go back up there. So section 1, and then it says C. So that means I am following A, I'm following B, I am following C, and under C I have I. So do you see how I'm going IC1, right? IC1 is taking me to chapter 1, certain infectious and parasitic guidelines. And this is on page, what page is that? 20. Okay, so I'm just going to click on it and it's going to take me there because I'm online. As you can see, I'm on chapter 1 now, and this is for infectious and parasitic diseases in your coding guidelines section of ICD-10 coding manual. I am going to review all of these because it's not too long anyways, just a few, maybe 1 or 2 pages. It is talking about HIV. It is talking about, what else is it talking about? Antibiotics. It's talking about coding for sepsis. I don't see anything about the Shigella, all right? I'm still going on and on and on, and I end up with the methicillin, Zika, corona, acute bronchitis, exposure screening. There's so much for COVID nowadays. And we end up on neoplasm chapter 2. That means there was nothing for Shigella. So I can easily, confidently say that I did not see any coding guidelines any further than what I have noticed on the tabular. And I can confidently code for this without having any kind of stress of there must be something that I did not follow. Because you checked everything. You checked the index, you checked the alphabetic index, you checked the tabular list, and you checked the coding guidelines section of your ICD. Okay, great. That is all you need to code for this scenario.